Hello everyone. Good afternoon everybody. I am Anuja Purohit from Prostate Wellness team. I'm sure all of you must be keeping good health. Today we are going to discuss a very important topic, that is renal calculi, or what we generally say kidney stones. So, renal calculi or kidney stones, these are hard pebble like pieces of material that form in one or both of our kidneys when high level of certain minerals are in our urine. Kidney stones vary in size and shape and also the location in kidney or the urinary system. They may be as small as grain of sand or as large as a pea size. Rarely, some kidney stones are as big as golf balls. If we have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as a urinary tract infection and many more. To throw more light on the subject and guide us on what's right for the diagnosis and treatment of renal calculi, today we have with us renowned urologist Dr. Sharath CT. Welcome, Dr. Sharath, to our live stream today.
Good afternoon, everyone. Thank you very much. I am Dr. Sharath, consultant urologist and andrologist from Trustwell Hospitals, Bengaluru. Thanks for the invitation. Yeah.
Thank you for joining, sir. Dr. Sharath CT is with us today. He is MBBS MS DNB in urology. He has a rich experience and hands-on expertise in urology, BPH, that is benign prostate hypertrophy, and stone management. He is currently practicing at Trustwell Hospitals, Bengaluru, as consultant urologist and andrologist. He is a laparoscopic and laser surgeon and runs his clinic Vinayaka Kidney Care at Rajarajeshwari Nagar. And he has completed more than 5,000 kidney surgeries. Dr. Sharath has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. So let's begin with our Q&A with Dr. Sharath and let us know more about kidney stones, its management, diagnosis, and many more things. Over to you, sir. Firstly,
Thank
I
you.
would
Thanks.
ask you,
Yeah.
what are the kidney stones?
See, first, people should understand what are kidney stones. The stones, how they form in the kidney. So, usually the kidney stones they are the solid crystals that may be a calcium, oxalate, uric acid, or cysteine. These are all minerals. So, they usually that is excreted from the our body through the urine. So, that the main work of the kidney is to excrete these minerals. So whenever these solid crystals, whatever that crystals I told, that gets super saturated, means once they form a like hard stone-like structure, when it will occur usually, usually our urine should be diluted. That is more amount of water should be taken. If the water content is less in the urine, then this crystals will get super saturated and it will aggregate and it will form a stone. So we should know what are the types of stones in the kidney that develop. Usually it will be calcium stones most of the time. It may be calcium oxalate or calcium phosphate. Sometimes it will be uric acid stones. Sometimes it will be cysteine stones. And sometimes it will be stovoid stones also. So these are the different types of stones based on the contents, like what minerals they are having. So as I earlier told, fluid intake. Less fluid intake is one of the reason where the urine gets concentrated more, super saturated with these minerals. So that will all aggregate together and forms a stone. So that is
Right.
called renal
So,
stones.
so kidney stones are formed because of a lack of proper
Water
excretion
intake.
of such minerals? Okay,
Yeah, yeah,
so
yeah,
if
yeah.
the water content decreases, so the
Yeah,
urine gets concentrated and these minerals get deposited in various sites inside our
yeah,
kidney and form renal stones. That is what I
yeah,
understood.
yeah. That's what. That is the
Yeah,
reason.
okay.
There are so
Right.
many
Uh,
reasons. There
hmm,
are so many etiologies and reasons for the stones. What I told earlier was reduced intake of the fluids. It's not only water,
Yes.
any other hydrated fluid, anything. If it's reduced intake of fluids is one of the main reason. Other than that, there are so many other reasons like taking excess of non-vegetarian diet, red meat, that is also one reason. Taking fried and beverages, fried items, oil and spicy items, and beverages like cola, Pepsi, all these things. And also sometimes the kidney stones can occur because of proteins, excess proteins intake. It may be in the form of cereals and pulses, and peanuts, groundnuts, spinach, those food which contains more calcium and oxalate. These also can cause. Sometimes there are some other than the dietary, there are some other reasons also, like familial history. Those who are having familial history of renal stones, they also can get. History of surgeries, like they would have done some bariatric surgeries for obesity, all these intestinal resection, gastrectomies, they will also get the stones. And also medications, like if they are taking excess of calcium and vitamin D and C tablets. So these are the risk factors for developing the stones. Sometimes other medical conditions like hyperparathyroidism, cystic fibrosis, and gout and arthritis. These are the other intestinal bowel disease. These are the other medical conditions that can cause us renal stones.
Right. So,
Yeah.
how can a person know that he or she is developing kidney stone, or are there any symptoms of developing kidney stones or having other than vague or very sharp shooting pain?
Mm.
Initially, can we know about such symptoms that our body reacts to?
See, basically, those who have developed kidney stones, 60 to 60% that will be incidental finding. Means they don't have much specific symptoms of stones. They will have vague abdominal pain or flank pain like that.
Hmm.
So if the stones are, the symptoms will develop based on the location of stones. If stones are in the kidney, usually the symptoms will not be there much. If stones comes down and it is stuck in the ureter, they will tell that urinary
Hmm.
passage, the ureter, that is a connecting tube from kidney to the bladder. If that stone gets
Hmm.
stuck in the ureter, they will get severe acute flank pain, and they will have
Okay.
vomiting, and they will have dysuria, that is called burning micturition. They will have blood in the urine and increased frequency and urgency, all these things. So stones get
Okay.
stuck, that will become emergency, and it will be very very much painful. And
Okay.
once pain, the stones are stuck there, they will go for complications like going for infection to the kidney, pyelonephritis, they will tell, fever, chills,
Right.
rigors, and there is a chance of kidney injury also. So
Oh, so renal
those,
stones can cause fever also.
yeah. Renal stones, not as per se,
Okay.
will not cause. Once it gets infected, because of
All
obstruction
right.
with the stones, they will develop infection in the kidney. That is called
Okay.
pyelonephritis. Once pyelonephritis
Right.
infection is there, they will have fever and chills.
Right. So,
Okay.
do kidney stones form in one or both kidneys? Are there any predisposition of developing kidney stone in any of the kidney?
So see, it's not like the stones will form only in one kidney or anything like that. Or it's forming in one side, nothing like that. It can develop in both the kidneys simultaneously also, or either
Mm.
of the kidney it will develop. The predisposing factors, what I told, the same. So what I told before, the etiological factors, these are the predisposing factors for the formation of these stones. But it can
Right.
occur in either of the kidney, and simultaneously both the kidney gets stones, and both the kidney gets obstructed with the stone. If that both the kidneys get obstructed, patient will develop anuria, means there is no urine at all. There won't be any urine output, and it's a medical emergency. So immediately
Oh,
that patient, if there is no urine output for next like 5 6 hours, they should be immediately go to emergency and hospital. They have to undergo procedure.
right.
So that can occur in
So,
any kidneys.
do all kidney stone require surgery?
Yeah, see, basically this is one of the point where we have to decide. See, once patient develops this type of symptoms and that patient is confirmed the diagnosis. So usually first we will do the patients having symptoms of kidney stones. We will evaluate them. taking proper history and physical examination. We will do the scan, simple basic ultrasonography of the kidney and bladder. So with ultrasound, we will identify 100% all the stones. So if any kidney is dilated, enlarged, that also we can assess. So do ultrasonography. If sometimes stones which are in the ureter, mid or upper ureter cannot be visualized with the uh, ultrasound, then we will ask for plain CT scan of the KUB. So other than
Okay.
that, we will do sometimes intravenous pyelogram also, and we will do some basic tests like urinary examination, urine routine, renal function test like creatinine and urea, and also we will do 24-hour of urinary examination. That is mainly for
Right.
recurrent stones. So like those who have two to three times incidents in last 1 year, they have family history of stones. In those cases, we will do 24 hours urine analysis for these minerals, what I told, calcium, oxalate, uric acid, and citrate like that. So these are the investigations we will do. Then you come to the treatment part. Treatment mainly depends on the size of the stone and symptoms,
Okay.
obviously patient symptoms. So usually all kidney stones are not necessarily treated. Stones which are less than 4 millimeter, usually it will pass out. So take plenty of fluids, water, and we will give some medications like alpha blockers, tamsulosin or alfuzosin will come. It will relax the ureter and it will make the passage wide so that stone will get expelled. So they have to drink minimum of 2.5 to 3 liters of water per day and take these medications. And also we will give some for relaxing the ureter and this thing we can give alpha blocker and for pain killers also. So less than 4 usually spontaneously it will pass out. So if stones are increased size like more than 8 more than 1 centimeter, really needs surgery. Okay, so no, it's like
Okay.
not all the stones need treatment. If stones which are stuck in the ureter and it's larger stone more than 1 centimeter and it's persistent obstruction more than 2 weeks, then they have to undergo surgery.
Right. Okay. So how laser surgery help in removing renal stones?
Yeah, that's what. So basically, as I told, those stones which are obstructed and it's larger stones, we have to remove them.
Hmm.
So treatment of renal stones is mainly if it's surgical, we should first know the where is the location of stone, whether it is in the kidney or in the ureter or it is in the bladder. So basically,
Okay.
the stones which are obstructed in the ureter, we can pass small telescope, that is ureteroscope we will tell. We'll pass that ureteroscope
Mhm.
into the ureter and we will blast the stone. If it's a larger stone, we can use laser and blast it. If it's a smaller stone, we can just basket it out. Those were stones which are in the kidneys. That treatment depends on the size of the stones. So if it is less than 1 centimeter, and it's like ounce field unit we will tell the density of the stones. If it is less than 900, we can give trial of ESWL, that is called extracorporeal shockwave lithotripsy, where we'll pass a shock waves from the skin that will fragment the stone. If stones are more than 1 centimeter and it's very hard stones, like I told, calcium oxalate stones are very hard, that type the shock waves will not useful. So if it's more than 1 centimeter and Hounsfield unit more than 1,000, then we have to tackle them with a uh, either a laser. So usually we will tell it is a RIRS, retrograde intrarenal surgery. We will pass a flexible ureteroscope into the kidney. We will see the stone and we will fragment the stone with a laser. We have advanced thulium laser now. Previously they were using holmium, now thulium lasers. So they are most efficacious and we can use it for fragmenting, dusting and powdering the stone, and we'll completely powder the stone. So another, like if the stone is more than 2 and 3 centimeter stones, they will call staghorn stones in the kidney, where even laser it will take longer time with the laser. In that we will do PCNL, that is called percutaneous nephrolithotomy, where we'll form a tract in the backside in the flank, and we will form a small tract into the kidney, and we will visualize the stone and we'll fragment it with the lithoclast.
Oh,
So these are the treatment options for surgical treatment options for kidney and ureteric stones.
Right. Are there any gender-related predisposition related to renal calculi? I mean, if males are more predisposed to developing renal calculi or women?
Yeah, see, basically, as per the gender is taken, usually stones occurs more in males compared to females. So
Okay.
reason may be multiple reasons. See, basically, the stone can occur because of dehydration and reduced intake of fluid. Mostly the males, they will be more time outside and they exposed to the sunlight more. So the chance of occurrence of 5% chances more in males compared to females, and it's usually occurs between more incidence in 40 to 50 years of age group, means young and mid adult group age group. And
Hmm.
chances are 10%, 10 to 15 in males, and females it is 5 to 10%. So higher chances in
Oh,
males compared to females.
right. Yes. One of our viewers, Rahul Bastwar, has a question for you. He's
Yeah.
asking, how can kidney stones lead to kidney damage?
See, kidney. See, basically, kidney stones means that can obstruct the passage of urine. So the kidney work is to form a urine, and it will excrete it through the normal urinary passage. If stones get stuck in the passage, the kidney will get enlarged. It will increase in size. That is called hydronephrosis. We will tell the obstruction to the kidney. Once obstruction is there, it will enlarge and it will get infected, and stones also gets infected. Once there is an infection, that will damage the kidney, parenchyma and cortex, everything. So that will cause us complete, if the stone is obstructed for longer time, like more than 1 month, 1.5 months and all, the entire parenchyma will get damaged and kidney will stop functioning. So mainly the stone will cause obstruction to the kidney.
Hmm.
That's the reason for
Okay, so
kidney
due to
failures.
that fluid accumulation inside the kidney, which is
Yeah, yeah,
not
yeah.
being able to come
Come
out
out.
of our body, that creates all problems and
Yeah,
enlargement
yeah,
of
yeah.
kidney. Okay,
That is the reason.
some people, more in women, we see that urinary tract infection is very much common among females.
Yeah,
So,
yeah, yeah.
is there any relation of urinary tract, frequent UTI, and kidney stone development?
Yeah, definitely. See, basically, young females, they will have recurrent attacks of urinary tract infection. They will have dysuria, burning sensation, urgency, frequency. So usually, one episode or 2 episodes, we can give antibiotics and do urine routine and culture and give antibiotics. But if the patient is getting a recurrent urinary tract infection, that is 3 to 4 times in a year, every 2 to 3 months once, if she is getting there is a chance of suspecting kidney stones. So in that cases, we should evaluate we should do a simple ultrasonography of the kidney and renal function test. So sometimes there are a lot of chances there will be a kidney stones that is presenting as a urinary tract infection in females, and they
Okay,
should evaluate them, like they should assess the blood in the urine also. So that is
okay,
also one symptom. So recurrent UTI in
right,
females, we should consider kidney stones also.
right. One more question is from
Yeah.
our viewer, A. Raju. He is asking, can a CT scan detect all types of kidney stones?
See, CT scan is the investigation of choice. So ultrasound is just a initial evaluation for the kidney stone, but we should do kidney CT scan, that to a contrast enhanced CT scan of the kidney, ureter and bladder. That is called CCT KB will tell. So that will entirely evaluate the kidney from to the bladder. So kidney stones has to be confirmed with CT scan. And it will identify all types of stones. In above that, it will also tells what is the function of the kidney, how is the parenchymal thickness, and what is the size of stone and exact location of stones, in which calyx the stone is there and how many stones are there, exact size of stone, and what is the density of the stone. I told already, ounce filled unit. Based on the ounce filled unit, it will tell whether it's a soft stone or it's a hard stone. So it is the investigation of choice for all kidney stone, and it will identify all stones.
Right. Okay. So it is like the
Yeah, yeah, yeah,
all-in-one procedure to know everything about each of the kidney stones.
yeah, yeah, yeah.
Yeah.
And there are we
You
should
said that, yes.
no, if there are measures to prevent the kidney stones, that I will tell in the later. You can ask some other questions. Yeah.
Yeah, I was about to ask that.
Yeah.
How much fluid should a person drink to prevent kidney stone formation? Because you said that average 2 to 3 liters fluid should be taken for proper, flushing
Yeah,
out
yeah,
of
yeah.
all
It's
the
see for
toxins and yes.
middle-aged men or women, they have to consume at least minimum 2.5 to 3 liters of water per day, and they have to excrete at least 2.5 liters of urine. And the urine we are passing, that should be completely diluted urine. There should not be any high concentrated urine, and there should be, that should be either pale yellow color or white color. So
Hmm.
amount of fluid intake is very very important. Minimum 3 liters is indicated. And fluids means not only water, it may be in the form of other things also, like they can take cranberry juices, they can take citrus juices like lemon, orange, like that. So it includes all fluids, but they should avoid beverages. I told before,
Right.
this Sprite,
Yes.
cola, all these things should be avoided. They should
If some
avoid
people,
dehydration.
yes, you also mentioned about some medications. People who are on medications for a long time,
Yeah.
they also may get kidney stones. So, what are those diseases whose medications can cause kidney stone formation?
See, basically the medicines like those who are taking, they are some rheumatoid arthritis or gout. That's called joint disorders. They will tell, or osteoarthritis. They will take lot of calcium tablets. They will be supplemented with lot of vitamin D, vitamin C. This like taking medicine, calcium and all is okay, but it should not be excess. They should not take overdose of calcium tablets, vitamin D, vitamin C tablets. So that will all excreted through the kidney. So they will precipitate in the kidney. So sometimes they will take diuretics also more. Diuretics like means that will form more urine. So that also will excrete large amount of water from the body, and they will get dehydrated. Like thiazide diuretics, they will tell. And other than that, mainly the calcium tablets, these medicines, and some medical disorders, they will have underlying diseases like what I told before. They will have hyperparathyroidism, where parathyroid hormones are more. That also will cause increased production of calcium, and that osteoporosis and all that causes increased calcium excretion. And also, I told some bariatric surgery they will do, like they will do sleeve gastrectomy for obesity and all. So they also, and intestinal resections they will do, where absorption of the this I told that calcium, magnesium, that is oxalate absorption will be more in bariatric surgeries.
Okay.
That also they form stones more. And
Right.
another thing I told is this thing. Mainly, they have to avoid these surgeries. And the
Right.
diabetes and hypertension also one of the leading.
Okay. In modern times, diet and fluid and also stress. These are the three factors which I guess influence all of the diseases which we encounter in our day-to-day life. Stress is also related to, from starting from common cold to any severe kind of disorders.
Yeah.
Also dietary imbalance, or as you earlier said, not having so much fluid intake for a
Yeah.
longer period of time, and also stress are the factors which are causing all of the diseases. So what is the role of proper diet for preventing kidney stone formation and also preventing the recurrence of kidney stones once the stone is removed?
Dietary modifications are really very important for preventing the recurrence of the stone and preventing the stones. So we should know what we are eating. That is very very important. So whatever you eat in a moderate quantity. That is very important. Excessive intake of any diet, that will be hazardous to the health. See, you think drinking milk is okay, but they should not drink daily 2 liters of milk only. That is the reason. So what I am telling is, excess of any diet, that should be avoided. And red meat also, eating non-vegetarian diet, excessive salts, adding excessive salts, and fried items and fish, especially fish, and so many other food like which are rich in calcium and oxalate, spinach, tomato. So these all vegetables that contains more amount of calcium and oxalate. So excessive intake of one diet should be avoided. That is the main thing. And avoid stress. Stress is the reason for most of the health issues. So we
Yes.
should manage the stress and diet in a proper way so that we can prevent the formation of the stones. That is the main thing.
Right. One more thing I would like to ask you is, after having kidney stone surgery or after having any kind of laser surgery or kidney removal surgeries, what care should a patient take so that he or she can prevent the recurrence and may not develop any complications post surgery?
Yeah, yeah. See, one surgery is done usually the next. These are all renal surgeries are nowadays day care. We will do it in the morning and we will discharge either in the evening or next day. So after that, they should take care of their post-operative period in a good way. They should mainly should avoid infection. That is the main thing. So they should take whatever antibiotics and whatever medicines we have prescribed in a proper way. Good amount of water intake is important. Along with that, they should take some. We will give some medications to prevent the further formation of stones. At least for 3 months, they have to take that citrate, magnesium and potassium citrate. We will advise that citrate syrup or in a tablet form that they have to take it. And I told already, diet restrictions are important. About those diet I told, which are rich in calcium and oxalate, that should be avoided, and they should avoid at least like excess of going to the traveling in a hot climate, all these things, and hard water, intake of more hard water, unfiltered water, that has to be avoided. They should avoid traveling also, at least for one or 2 weeks. So mainly, basically, all dietary lifestyle habits should be changed. Diet, smoking, alcohol should be
Right.
avoided. So sometimes what we will do, recurrent stones, there is patients will get recurrent stones, means in a year they will get 3 to 4 times. In that we will take the stone and we'll send that for analysis. That is called stone analysis. We will
Mhm.
assess the what type of stone and why it is occurred. We will do metabolic evaluation in the blood. We will check for calcium, uric acid, parathyroid hormones, and we will also lactate LDH, this phosphate, sodium, all these things we will check in the blood, and also in urine. Also 24 hours of urine collection and assess that urine for these minerals, and we will treat the underlying abnormality. What is the reason for occurring of recurrent stones? So that also
Mhm.
they should like that also we should do so that we can prevent the formation of recurrent stones.
Right. And so that we know the actual reason behind
Yeah, yeah, yeah.
so much recurrence of kidney stones, right?
Just treating the stones is of also important. Along with that, we should treat why that stones are occurring and what is the root cause for the recurrent renal stones. That should be diagnosed and tackled properly.
Right. Before concluding our today's live session, what piece of advice you would like to give to our viewers about health of overall health of kidneys and the excretion system and not developing kidney stones?
See, basically, the people are not much aware about the kidney health because they know only heart or brain. These are all acute emergencies. But kidney is one of the major
Yes.
organ. It plays a very vital role in almost all the developments. Okay, there is a lot of hormones produced in the kidney, and there is a lot of filtration and excretion is occurring in the kidney. So they should know and aware of kidney health, very important. So mainly they have to control on their diet. That is the first thing I will advise them. Take plenty of filtered fresh water. Avoid excess of non-vegetarian diet. And I told they have to take care of the diet very well. And another thing is they have to take care of their lifestyle stress, and they have to manage the comorbidities like diabetes is one of the main root cause for kidney failure. So they have to control the sugars very well. Sugar control is based on their diet, what they will eat.
Diet.
So one thing is
Absolutely.
diet. Yeah, the diet will be the major role for any of the diseases in our body. So control of diabetes, hypertension, and avoid unnecessary intake of like junk foods and all. That is the main thing, and concentrate on the fluid intake. That is the main advice I will give, and they should know what are the consequences and complications of kidney failure. That is very important.
Right. And of course, if they develop any symptoms of, if they have a doubt of kidney related any problems or pain, so they should consult a urologist or a doctor
Urologist.
immediately and should not
Yeah, yeah,
use
yeah.
over the counter medicines as well.
That is definitely that is important. Anything, see, simple, if they have diagnosed, like simple ultrasound will tell the kidney stones are there. They should not neglect even it is a small stone. Make sure that they, even it's a small stone, they have to consult urologist and take the medications and repeat the scan and make sure that that stone has passed out. Otherwise there is a long standing stones in the kidney is definitely a endangers to the life, and we lose the life. That is one of the important message they should
Right.
know.
So negligence can be dangerous about our overall
Kidney stone.
health.
Yeah, yeah, yeah.
Yes.
That is the
Okay.
yeah.
Thank you, Dr. Sharath CT, for
Yeah.
your valuable time. It has been quite an informative session for our viewers and for all of us. We look
Okay.
forward
Thank
for
you.
many such informative sessions in coming time.
Yeah. Thank you. Thank you for you also for inviting me.